Good morning, ladies and gentlemen. I'm Dr. Chag-Chih from the Department of Occupational Therapy at Kaohsiung Medical University. Today, I'm pleased to share with you my ongoing work, the systematic application of the Lifestyle Redesign program in Taiwan, which we have expanded it into a series of Lifestyle Modification Program, or LMP series. My work builds on the foundation of lifestyle redesign developed at the University of Southern California by Dr. Florence Clark and colleagues, demonstrated that engagement in meaningful occupation could improve health and quality of life among community-dwelling older adults. This strong evidence inspired me to explore how we can adapt these principles within Taiwan's culture and community context. So the work of systematic application of lifestyle redesign in Taiwan includes 3 dimensions. First is to develop and examine series of LMP and outcome measurements in the research dimension. Second is innovative pedagogies in the education dimension. And third, LMP training workshop for long-term care 2.0 in the community dimension. I will then show you examples of each dimension, and it all started with the Lifestyle Modification Program, LMP. The core beliefs of LMP is simple yet powerful. Older adults can enhance their health and well-being through meaningful occupation. So what is LMP? It first provides the participants with tools to analyze the health benefits of their own occupation. Second, these tools allow them to understand and alter their approaches to choose and to perform and to orchestrate everyday activities, thereby optimizing quality of life and health. And third, the participants learn to use these tools over time through experience, trial and error, risk-taking, habit and routine formation, and coaching by OTs. It is created for adults aged 55 and above, living independently in the community. The participants receive the intervention in the form of a classroom work when they took the class once and 2 hours per week for 24 weeks in total. The class has to be a closed group. It is not an open group. So the students have to be set. You don't change the students. And it's very interesting because the older adults in Taiwan, they don't like to see themselves to be participating in a treatment program because they think they are not sick. So if you format it in a classroom setting, they are willing and happy to participate in the program. So we follow. So the research, the examine of the outcomes. We follow a 3-phase design. Phase 1 is needs assessment and program development, and phase 2 is intervention and data collection using embedded mixed method design. Here you can see we have intervention and control groups. We have quantitative pre and post measures and 3 interviews before, during, and after intervention. And phase 3 is analysis and interpretation of both quantitative and qualitative results. This process allows us to combine evidence, practice, and reflection. 12 modules were developed. They are namely the meaning of everyday occupation, aging, health and quality of life, stretch and range of motion dance, ergonomic, emotion and stress management, active mind for dementia prevention, and cognitive training. For prevention, including muscle strengthening and physical activeness improvement. Leisure, technology, and community resources 1 and 2, dining and cooking, and graduation party. Each module lasting 1 to 2 weeks and Each session begins by establishing group cohesiveness and belonging, which became essential for participants' engagement across the 24-week program. This structure not only builds skills, but also nurtures the sense of connection and self-efficacy. So the core concept with each module is integration into daily living. Take quadriceps muscle strengthening, for example. We don't teach them how to do it, but we will let the participants think and share with their group members about how they would do it in their daily life. For instance, we use standing up slowly for sitting position as a way of training quadriceps, like this. And we ask them, you can do this, stand it up slowly, or even slower, and then sitting down slow. And by that, if you want to train your quadriceps, of course, you can ask them, keep doing it, and then once, 3 times per day, and 10 rounds per time, things like that. But lifestyle modification program is not doing this. We ask them to think about how they would incorporate these trainings into their own daily livings. So, like one obasan, I don't know if it's okay. One obasan would say, "Oh, okay, sensei, I would use this every time when I go to toilet." And then we encourage them to keep doing it. And next week when they come back, I ask them, how do you feel about it? And then if it's a successful experiences, she will tell other group members. And if she doesn't feel good about it, there must be someone feel good about what they're doing. And then I'll ask them, facilitate their discussions to form a strong belief that we should keep doing it. And because it is them who themselves who think about the way to do that into their daily living. So it's easier for them to keep doing it in their daily life. And yes, and for another Oji-san, I have another example. Another Oji-san say, I can do it during the commercial time when I'm watching TV drama. So he's watching TV dramas, and there's commercial times, and when it's commercial time, he starts to do this, and then the commercial time ends, and then he keeps watching TV program. So even though he's watching TV program for a long time, he's exercising for a long time as well. So, here are some highlights of treatment modules. For example, we teach the principles of stretching and did them to practice it. But the most important part is for them to think about how they are going to incorporate this into their daily living and keep doing it. And we also let them play brain games and practice adaptive strategies to support cognitive health. Take this for example. Take this game for example. We don't just let them play this game. We let them play this game first through video. But we ask them whenever they have a chance in their real life situation, take this for example. You will go to beach and then you see people playing on the beach. And can you twist your mind a little bit or spend a little bit of time to train yourself like, so everyone please play with me. Well, which will be the picture taken by the boy in the yellow shirt? What are your answers? So we let the older adults play this, and we ask them to practice this in their daily living. See, when you going back home, maybe you choose to a new road going back home, and you pay attention to the stores and different things happen on the way when you go back to train your cognitive function. So what's the answer? Anyways, I don't want to trouble you. So the answer is number 3. All right. So so we also the module of technology learning. We also use smartphone. Teach them to use smartphone to plan trips, take photos, and share memories in the middle of it. And the photo are taken by iPhone in the summer date. Welcome to Taiwan. it's beautiful. So our evaluation revealed that participants in the LMP group showed significant greater improvements in quality of life and meaningful activity participation compared with control group. This data provides objective support that the LMP effectively enhances occupational engagement and health outcomes. And the qualitative analysis offers a deeper understanding. We identify 4 key things from the participants. First is a new vision toward aging. The participants realized that positive emotions and enjoyable occupations improve health beyond medication. And second is self-reflection on daily life. They learn to recognize daily routines for better health and quality of life. And the third theme is emotional support. They feel understood and supported through peer sharing. And the fourth theme is generalizing success. They apply learned strategies to new areas, like using technology to help hosting social events, etc. and etc. These voices remind us that occupational therapy changes not only what people do, but how they view themselves. Building on the success of the original LMP, we create a series of derived programs. First is PALM, which is a physical active lifestyle modification program, and then Cognition in Life KMU program, and then LIME program, which is a short-term lifestyle modification for the elderly program, and then it's a spiritual lifestyle modification program, which integrate music and reflection supported by NSTC. And we also have studies on stress coping and of homeless adults. And we also develop TMAPA, the Taiwan Meaningful Activity Participation Assessment. Together, this represents a systematic ecosystem of life-based interventions. Our work also expands to the community dimension by hosting LMP training workshops for long-term care 2.0, which is funded by the Ministry of Health and Welfare in Taiwan. And we have already trained 14 lecturers, 31 instructors, 215 assistants, which are all OTs, qualified to practice LMP in long-term care 2.0 system in Taiwan. And our work also expands into education dimension with innovative pedagogies. By the support from Ministry of Education, we launched massive open online courses, MOOCs, on E1 titled 3 courses. First, reconstructing healthy aging life. Second, living a healthy second life. Third, enjoy a healthy third life. I'm sorry. So these courses reach over 30,000 viewers, 30万 viewers, and were adopted 24 times by 13 other universities online. And also, a major strength of our project lies in innovative pedagogy, right? So I blend online learning with experiential community practice. So we effectively flip the traditional classroom, making learning active, reflective, and socially engaged. This approach not only benefits older adults, but also shapes a new generation of occupational therapists who learn through doing and connecting. This teaching practice research also received a National Best Teaching Practice Research Award. Looking forward, we aim to expand LMPs to caregivers and people with chronic illness, enhance digital literacies and inclusive technology use among older adults, and continue developing outcome tools to measure meaningful participation. Our vision is to create a sustainable ecosystem of occupation-based lifestyle program that contributes to the personal and community well-being. In conclusion, also welcome if you have any good research ideas or you want to develop things like this, let's cooperate with each other. I would be glad to do so. And in conclusion, the Lifestyle Modification Program represents a localized and systematic adaptation of lifestyle redesign approach. Through this integration of education, research, and community engagement, we have empowered all the adults to take charge of their health through meaningful occupation. And we also advance occupational therapy education through innovative teaching. And we strengthen community connections and participation. Thank you very much for your attention. I'd be more than happy to take any questions.